are watching the Doctalk show.
Fighting the coronavirus is almost like a war-like situation, but in this case, you're fighting an invisible enemy. And the forefront line workers are the healthcare workers. So I want to find out from the Ministry of Health, represented by the Director General of Health Services, how they are protecting the frontline workers against this invisible enemy, coronavirus. So Dr. Mwevesa, how are you protecting the health workers? Who are the frontline fighters of this coronavirus? How are you protecting them to make sure they do not get infected?
First of all, I'll mention that we have trained all our staff to know what to do. We have trained those who are responsible for collecting samples. We have trained those who are responsible for treatment cases, and we have trained those who are responsible for the different assignments, and they know themselves. So this one shows that not every staff in the health center will treat coronavirus.
Okay.
That's why
specific people.
Specific people.
Okay.
That's why even we say that if somebody calls in, we don't tell them go to the nearest health center like we used to say. If you are sick, go to the nearest health center. In this time we say call us, because in that case we send the people who are really trained and they know what to do. We don't want, if you have the signs and symptoms, to go to a health center X and then you go there and infect our staff who may not have been appropriately skilled in this particular coronavirus.
Okay. So in the training of the health workers.
There's the training of health workers.
Okay.
So then related to that, we are providing the protective equipment related to the assignment. If you are responsible for treating or collecting samples, there's particular equipment you are provided for. If, for instance, you are a lab person in Kanungu and you are always to pick samples from the community, you have particular equipment which is provided to you for collecting samples. Okay. The people who are in treatment centers or isolation centers are also provided with relevant protective equipment for treatment of those patients. Okay. Then all other health workers, we have sent them the late protection that they require, like gloves and masks. I want to urge my health workers here that you don't need to don everything and gown and everything like you are going to the moon just to treat an antenatal care mother or to immunize a child. All you need is a surgical mask and gloves. And that is adequate for you as a health worker, treating all other cases in a health center.
That is the very minimum for any health worker?
Very minimum for every health worker. Okay. We want every health worker going forward to have gloves and surgical masks. Then the N95 masks and the donning and everything will be exclusively for those in the treatment centers and those who are collecting samples. And we have prepositioned those materials to the districts and the hospitals.
Thank you for that elaboration. So I think it helps relieve anxiety because many health workers are wondering where are they getting their PPE from. They're not protected adequately. But if you say the minimum is the surgical mask and the gloves, yes, I believe that is very reassuring.
That's adequate.
And I think there was research to show that these equipments are sufficient to protect against the virus. Maybe Dr. Idri could explain how is the mask sufficient? Because most people would think you have to put on the entire robe, the goggles for the eyes, the N95s for the breathing. Why do they say the surgical mask and the gloves are sufficient?
There was a lot of anxiety amongst the health workers following a comment which initially they thought was attributed to the Minister of Health, that health workers, it was only those working in the treatment units who required PPE.
Yes.
We have now clarified and we have worked with the Ministry of Health to have very clear guidelines that the majority of us, the more than 60,000 health workers in this country, that what we need is that surgical mask, and it is able to filter out more than 95% of particles or germs which come, including viruses, which come in contact. And that as we wear gloves, as we handle patients who come to us, clients who come to us, and we wear the masks, we are adequately protected. And this also gives us the protection, because sometimes a patient who is coming to the health unit does not necessarily come with a label that I have coronavirus. No, it's,
So it's
only
basically
after
the
the
basic
assessment.
minimum.
It is that basic minimum, and it is adequate.
Okay.
It is
So whether they are dealing with the patient or with suspect or not, they have to have that PPE.
Yes, they have to have that PPE. And we have worked with the Ministry of Health, and we have now been assured that all this basic protection is going to be available to all health workers throughout the country as they handle the patient.
Excellent. So, Dr. Muwisa, sorry. So if a health worker gets infected, what happens to them?
If our health worker gets infected, of course we take them through this routine process. If he's tested and is positive, then we isolate you like any other patient. We treat you. We go through the same process. But what we emphasize is proper protection. Let's clarify it. Are you saying infected from our treatment centers or
No,
infected
yes,
like any other person in the
they are
community?
treating someone in,
Yes.
in like a corona treatment center.
In a corona treatment
then
center.
they also fall sick.
Exactly.
So what
of course, we
happens to
shall
them?
isolate you. But what I want to emphasize is that the training we have given them and the protective equipment we give them, if you follow the instructions and the guidelines that we give them, then the chances of being infected are really very, very, very minimal because they are very well protected. They don't look like they are going in the moon. So most likely you will not get infected in the treatment center.
Most likely. Unlikely.
Mostly. Very unlikely.
Okay.
It will be.
And then,
if you follow the guidelines,
if we follow
as you
the
have been
guidelines.
trained.
So how about the hospitals now? Let's talk about the capacity of the hospitals to handle the cases. Are the hospitals well equipped, well stocked with machines in case someone requires life support? Are there enough fluids, medicines? How prepared are the hospitals in the country?
Thank you. The hospitals are prepared, but in our planning scenario, we are looking at different scenarios. We have been looking at different scenarios. Remember, the WHO projection had indicated that by the end of April in Uganda, we would have about 18,000 cases. But thank God we are still at 55. So in that scenario, we had prepared ourselves. In the event that you have few cases like we have now, we could manage them at Mulago and all the regional referral hospitals. But in the event that we get very big numbers, then we decentralize further down. We go to the general hospitals, which are over 55 in the country. The regional referral hospitals are 16 plus Mulago. And then the health center force, which are about 176. That would give us a bed capacity of over 10,000. As you also know that 80% of the cases are really mild to moderate. Ideally, they could even be managed at a health center for. But since this was the first case, first time, we did not want to take those chances. That's why we manage them at Mulago, we are managing them at Entebbe. But in the event that we are overwhelmed by numbers, then we can go through that scenario system I've explained. But also, the 15% who normally get some severe cases, which will require some oxygen and the like, those would be treated at regional referral hospitals, the 16 regional referral hospitals I've talked to you about. And each of those is being developed to build a capacity of about 10 ICUs, but ICUs would be mainly for the critical cases, the 5%. But the regional referral hospitals, the 16, are being prepared to handle the 15% and the 5% critical cases,
those very critical
which require
ICUs.
ICU.
So the ministry has plans
the
to
capacity is
build
there.
and develop the ICUs.
The PPE is in place, the medicines are in place, but of course, as you've realized, medicine is really supportive, fluids, Panadol, vitamin C, and for medicine for treatment of other diseases, which we always treat anyway. So that is being provided. And the staff are in place. We have also recruited a few more staff to back up the facilities. So I can say we are prepared in terms of logistics. We are prepared in terms of human resource. We are prepared in terms of supplies. But also, that depends on the numbers.
It depends on how the epidemic is going to turn out.
Exactly how it evolves.
All right, but it's reassuring that the ministry is taking very serious measures to plan for the future. In case things fall out of hand, they already have a plan to curb and control the spread of the pandemic. So more about coronavirus and its prevention coming after the break.
You are watching the Doctalk Show.